Hi there, I'm Stephanie Ruhle. It is Friday, March 20th. What a week. Here's what's happening now. New cases, new restrictions, and shortage of medical supplies. As one doctor puts it, it is like they are at war with no ammunition. Here in the United States, the number of confirmed coronavirus cases has surpassed 14,000, up more than 5,000 since we came on air yesterday. A total of 206 people have died. And we are now seeing the most drastic measures taken yet. Last night, California's governor issued a shelter-in-place order for the entire state, asking 40 million residents to stay at home unless picking up groceries or medicine. This as doctors across our nation say the lack of protective gear like masks and gowns is dire. The CDC telling doctors if they don't have access to masks, they can use bandanas or scarves as a last resort. In the United States, one hospital in Indiana so desperate that they're asking the public to sew protective masks and drop them off in a designated spot. Yesterday, the president announced potential drugs that could be used to treat coronavirus, but the FDA says they have not been approved to do that. And in Washington state, Republicans released their plan to help businesses and individuals struggling with the deep economic impact. The $1 trillion package includes a $1,200 cash payment to many Americans, with Democrats saying it doesn't go far enough to help workers. We're going to cover every angle of this for you this morning. First to NBC's Gotti Schwartz, who is at home in Los Angeles following that shelter-in-place order. Gotti, this is a very drastic step. I mean, the entire state of California. Why specifically did the governor decide to do this now?
Yeah, it was such a sobering moment for all of us here in California to watch the TV last night, to see Governor Gavin Newsom address the entire state of some 40 million people and say that everyone is to shelter in place. There is this stay-at-home order that stretches all across California. And the moment that was the most staggering was when he talked about how there was the possibility that 25 million Californians could get COVID-19. Now, it turns out that that is an estimate that they were using. It's a projection, and that's the reason why they're taking so many of these drastic measures. But what that means is that most people need to stay at home. Most people need to not go out unless they're going out for things like food or essentials. They're basically shutting down all non-essential businesses in the entire state of California, which is leaving a lot of questions as to what is essential. So far, we know that transportation, food services, from agriculture all the way up the supply chain to grocery stores, those are still going to be open, and people are still able to go around and walk in their neighborhoods, walk their dogs, but for the most part, people are being asked to settle at home and settle in for the long run. Steph?
All right, be safe where you are. Now let's go to NBC's Garrett Hake. He is in another community that's sheltering in place in Oak Park, Illinois. Garrett, Oak Park, why specifically did that city take this step when we're not seeing it around the rest of the state?
Yeah, this is a smaller community with relatively few cases compared to other parts of the country, but this is also a community of about 50,000 people, but with 9 nursing homes and 2 hospitals within the boundaries of this town, and that's why the mayor felt it was important to take dramatic action. Now, unlike in California, this order is not punishable by a fine or imprisonment or anything like that, but the goal was to shock the system here a little bit and convince people to stay off the streets, stay out of businesses, and stay home. This is what the mayor told me, trying to explain his decision.
If you have to visit your doctor, go to a gas station, go to a bank, if you're doing things to fix your home so you can have a good shelter, the ordinance we put in place, we have intentionally made it an ordinance that has broad exceptions, because this is not a way for us to penalize people. This is a way for us to say to people and ask him to recognize the magnitude and the gravity of this situation.
So, Steph, we're not breaking any rules to be out here on the street right now with our small team, but the mayor wants everyone in this community to be taking this seriously. The question is, will anyone else around the state of Illinois or other places outside of California soon follow suit?
Well, I sure hope they do. Let's go now to Tom Winter. He's covering New York City. Tom, here's what a lot of people here don't get. New York has nearly 5 times as many cases than California, but we haven't taken the drastic measures they have. Why not?
Well, I think, Stephanie, it's what California has done is done very similar to what New York has already done, just in a bit of a different name, and I'll explain. Here in New York City, all the things that California announced, you can't go to restaurants, you can't go to bars, you can't go to pubs, you can't assemble. Literally, as you were coming on the air this morning, we got word from the governors of Pennsylvania, New Jersey, and New York and Connecticut saying barbershops closed, tattoo parlors are closed. You can't go to a dentist's office except for an emergency. A lot of the steps that California enacted in one fell swoop last night has already been enacted here in New York, and it is working. I know the NYPD and FDNY fire marshals have gone out to over 10,000 businesses to check on them to make sure that they're following the rules. Stephanie, only 6 of them have received any sort of summons or any sort of a notice for not following the law. So basically, Stephanie, you've got a situation that's very similar to California. The only difference is that businesses are allowed to send 25% of their employees actually physically into the office. We'll see if that starts to change, in which case it'll be pretty much California, just in a different name, Stephanie.
All right, Tom, thank you. There's also a lot of confusion over the lack of supplies we've been hearing about and possible treatments that are out there. So let's find out the truth. Joining me now to cut through all of this noise, Dr. Kavita Patel, former policy advisor in the Obama administration and an MSNBC medical contributor, and Dr. Michael Perskin, a geriatric specialist at NYU Langone Medical Center. Dr. Patel, to you first. The vice president said yesterday that companies have amped up production of masks and millions are available now. Yet story after story of doctors and nurses at actual hospitals are saying they're sewing their own equipment.
Absolutely, Stephanie. And as you mentioned, the CDC has even gotten into the game of at least giving advice to those of us in the medical profession to use, if worse comes to worse, bandanas. And you can imagine how that's being received by, the hundreds of thousands of physicians and nurses that are trying to battle the front lines. These masks that are being produced, yes, in fact, private, public sector, the strategic national stockpile. But the problem is they're just not coming fast enough to deal with the numbers that you're seeing all around the country.
Dr. Perskin, you are at a hospital here in New York City, one that's been hit the hardest. Help us understand what the shortage is like.
So I can give you one specific example. So because we have to essentially conserve our personal protective equipment, so-called PPE, it's important that we thought about, and my colleagues in the hospital and leadership have thought about that, about how to minimize the number of folks who need to go in a room with a person under investigation, as we call them, or someone with confirmed COVID illness. So as an example, we have a lot of technology. So we're having sort of iPad chats with patients and families to keep the social distance and conserving our PPE for important activities.
Dr. Perskin, how abnormal is this? Have you been in a situation before where you've had a shortage of basic materials?
Well, I think that I trained in the mid-'80s, and at that time, sometimes in the hospital, there were shortages, but really for a day or half a day. Nothing like this. I don't know that anyone practicing has had anything like this since the World War II.
Dr. Patel, the president says it's largely up to states and their governors to get these supplies. You're a former White House health policy advisor. Has that always been the case?
No, not at all. And you can imagine how that message has been received by the people working in the front lines in clinics and hospitals. It feels like the federal government, specifically the president, because let's be clear, Stephanie, you've got people at agencies who are working 24/7, but you have a leader who is sending a message, hey, you're on your own. And that's absolutely the wrong message that Americans need to hear when we're, honestly, all of us, including healthcare workers, are pretty anxious about how this is going to play out.
No doubt. Dr. Perskin, I want to talk about another message about possible drugs. Yesterday, the president said an anti-malaria drug is already showing tremendous promise in treating coronavirus. But this morning on the Today Show, Dr. Fauci, obviously the National Institute head of allergy and infectious diseases, he clarified it and said this.
These are drugs that anecdotally, without being done in a controlled trial, have some suggestion that they might work. We're getting stories from people who've tried them, but they've tried them in trials that are not controlled. So what we're saying is that we want to make them more available, but in the context of a protocol of some sort that would not only make them available, but that we can get some information as to whether they're safe and whether they really work.
Dr. Perskin, what does any of this mean? When the president says we're getting close, that's when my mother and father call me and say we're going to be all set.
Yes, well, I think one thing we should think about is, in general, research is done methodically and thoroughly. So this particular drug, as Dr. Fauci said, there's evidence that's pending. We don't have the evidence yet. I can hope that it will be fantastic, but I already know that there are cardiac side effects, which might even be more in older patients.
Explain.
So chloroquine is a drug that's been around for decades. It was for malaria, a good drug for malaria. So if you think about it, if you have malaria, you might take it. Young people got malaria in the Army and stuff. Those were probably the first users, although I don't know. As you get older, a drug like that can affect the heart rhythm and the electrical rhythm. So sometimes people don't even know they have very mild things until they get a drug like that. That's just one example of a potential harm. So I've had patients call me asking for prescriptions for this. There's a limited supply. That's not an appropriate use. The appropriate use is exactly what Dr. Fauci said, which is let's study it and let's use it where it would be the most effective. And if we have to, we'll use it on the sickest people because that's where the benefit would be the greatest.
Dr. Perskin, Dr. Patel, thank you so much. So great to have you here and make us smarter on this very important morning. While Americans are looking to Congress for help during this tough economic time, several senators are reportedly having helped themselves. On January 24th, senators were given a closed-door briefing on the coronavirus by top health officials. Over the next few weeks, several senators reportedly sold hundreds of thousands, if not millions of dollars of stocks. Senate Intel Chairman Richard Burr sold up to $1.7 million worth. Senator Dianne Feinstein sold up to $6 million worth. Senator James Inhofe sold up to $400,000, and Senator Kelly Loeffler dumped up to $3 million and bought shares of Oracle and Citrix, that does video conferencing used to support remote work. Meanwhile, here's what they were doing publicly. Some of these very same senators who knew what was happening and acting accordingly privately, making money, you know what they were publicly? Upbeat and cheerful, all about the outlook. In a Fox News op-ed, Senator Burr wrote that the U.S. today is better prepared than ever to face these threats. And here's Senator Loeffler. Are you ready for this? As late as March 10th.
The good news is the consumer is strong, the economy is strong, jobs are growing. Our president has done a fantastic job.
NBC News national security and intelligence correspondent Ken Delanian joins me now. Ken, explain to us why this is legal. They have confidential information that the rest of the public doesn't have, and then they're able to trade on that?
Well, Stephanie, legal experts tell me it's not entirely clear, but generally, to make a prosecutable case of insider trading, you need to prove that the defendant had specific information about an individual stock, not just general information that the economy was about to tank. But look, there is huge outrage about this, Stephanie, and particularly surrounding the case of Senator Burr, the chairman of the Intelligence Committee, because he's in a different category. He was getting almost daily briefings about the potential threats from coronavirus. They're all classified, and to this day, we don't know exactly what was said in those briefings. And he's the only person who has not said that he didn't make these trades on his own. In other words, the other senators have all said their financial advisors made the trades. In the case of Dianne Feinstein, she is saying they were her husband's transactions, that she had no input into them. Burr is not saying that. And And Burr sold an amount of stock that amounts to nearly his entire net worth, according to his financial disclosure statements. And the other outrage about Burr is that he was not saying publicly what he was saying privately to high-dollar donors in a speech in North Carolina, that this is a serious pandemic approaching potentially the levels of the 1918 flu pandemic. Donald Trump wasn't saying that publicly at the time, and neither was Senator Richard Burr, but he was trading as if he believed that, Stephanie.
Right around that time, I believe Eric Trump, an economic advisor to the President of the United States, Larry Kudlow, was telling the general population, get on out there and buy the dip. Joining me now, New York Congressman Sean Patrick Maloney, who sits on the House Intelligence Committee, and former New York Congressman Steve Israel, who is just coming out of quarantine himself after interacting with someone who did test positive for COVID-19. All right, Congressman Maloney, even if this is not illegal, is there not a code of ethics for people in Congress?
Well, look, I don't know what the facts are, and it's important that on an issue like this, you know what the facts are. I can tell you, I wouldn't be taking actions as a member of the Intelligence Committee that could call into question whether my focus was on the well-being of the country rather than my own well-being. We did pass the Stock Act a couple years ago in response to exactly this type of concern, that members were trading on inside information. But look, I'm going to keep my powder dry on this. I don't know what the facts are.
Congressman Israel?
Well, Congress has passed the Stock Act, as Congressman Maloney says. It is specifically and explicitly illegal for members of Congress to trade stocks based on inside information about those stocks. Now, whether Senator Burr had that information as a result of his classified briefings, as a result of being a member of the Gang of Eight, is something that clearly needs to be investigated. But, Stephanie, I would say, putting aside the legal standards, there is a moral and common sense standard here. I mean, I'm sure that Congressman Maloney is hearing in his district what I hear in mine. People are looking at their or my former district, people looking at their 401ks and seeing them completely devalued. I spoke to senior citizens yesterday who told me they're thinking about selling their house because they're not sure they're going to have any proceeds from their pensions. And meanwhile, you have the chairman of the Senate Intelligence Committee trading his stock when he thinks the stock's going to go low. This is a moral outrage, if not, even if it doesn't reach the legal standards.
Okay, Congressman Maloney, I understand that you want to keep your powder dry. How about this? Let's say they didn't even trade any stocks. But if in an intelligence briefing, they were told about an absolutely dire situation coming our way, is it not some sort of ethical violation that Kelly Loeffler would then go on television, Senator Burr write op-eds saying America the Beautiful, better than ever, look how strong our economy is, when they knew full well that there was a horrible tide coming our way?
Yes. Well, thank you for that question, because I feel very free to criticize that. I think that those of us who are leaders deserve, to share, who enjoy, I mean to say, the benefits of early warning, need to share that warning with the people we represent in a responsible way, not to create panic, of course. But I think those of us who've been tracking this knew that the response was inadequate. And some of us have been screaming that from the rooftops, saying we need to get ahead of this on hospital capacity, on supplies, on testing. And to be spending your time feathering your own nest or worrying about your own position is just the opposite of leadership. I mean, the point of being a public servant, as Nancy Pelosi said, is that we're the captains of this ship, and we should be the last ones off it if it's in trouble. We stay with this ship, and we take care of the people who are looking to us for that leadership now more than ever. I think that's the kind of thing that undermines people's confidence when they see leaders, worrying about themselves. And we just have too much of that right now in American politics. This is only going to work if people have confidence in their leaders, and if their leaders earn that trust by doing the selfless thing, not the selfish thing.
Congressman Israel, earlier this week, Tom Bossert said, if we work together in this terrible moment, it could be our finest hour. And every day we're talking about people doing that. We're actually seeing Congress work together in a bipartisan way. But when we see government leaders do things like this, jump on the rescue boat and then pull the ladder up while everyone else sinks, what is that supposed to tell America?
Well, it tells America, it fortifies the assumptions that Americans have that the deck is stacked, that the system is rigged. And, this is different from every other national crisis we have had. I mean, when John F. Kennedy said we're going to land Americans on the moon within a decade, we worked together, and senators and members of Congress didn't seek to profit on it. When the Russians launched Sputnik, nobody tried in leadership positions to profit on it. World War II, you didn't have senators, trading stock as a result of it. This is different. This can be a monumental moment in our history when we pull together, but this kind of thing really puts a deep scar on the process, and it's just got to end.
Well, I know there's going to be a lot more questions around this, questions on legality, morality. There is something these lawmakers could do. They could take all the profits they made and donate them to their local hospitals. Just a suggestion. Congressman, thank you so much for joining me. I appreciate it. We're paying close to Wall Street this morning, a day after Senate Republicans unveiled their plan for a $1 trillion coronavirus relief package that includes checks for Americans. It is the first step in negotiations with House Democrats on a bill to blunt the economic impact of the pandemic on everyday Americans. Joining us now, Jason Furman, Harvard economics professor and former chair of the White House Council of Economic Advisors, and Steve Leisman, our dear colleague from CNBC, where he covers markets and the Fed. Jason, I want to go to you first. It was you just a week ago who said, cut a check to every American. What do you think about what they're doing?
I think it has some of the right things in it. The checks are smaller for low-income families, which I think is wrong. Senator Romney has said that's wrong and should be fixed. And I think it's also important to understand this is only part of an approach. We need a comprehensive approach to this crisis. Cash payments are an important part, but we also need to strengthen unemployment insurance, strengthen nutritional assistance. States need a substantial amount of support that they're not getting in this bill. And so this is only, part of the answer, but I'm glad to see, I'm glad to see it moving forward.
Steve, what do you think of this? There's been a few different proposals. Rich Handler of Jefferies wrote a letter saying, don't just write the checks. It's not that the people shouldn't get the money, but what we want to make sure is when we get on the other side of Corona, they still have jobs to go to. So instead, funnel this through the companies they currently work at. The government knows, based on payroll, exactly how people get paid and how it works. So give the money to the companies. If they're misusing it, the government would know, and use that as the mechanism to continue to pay people while keeping businesses afloat.
I mean, that seems like a good idea. There's a lot of good ideas floating around, Stephanie. I think the issue is that in Washington, there's a little confusion between aid and stimulus. And the aid we're talking about would get people from here to there, wherever there is, which would to tide them over. Give aid to businesses so they don't shutter, so that the employees have a place to go back to. Stimulus would help on the back end of that, and I think that's what he's talking about, which is when people come back to work, they don't necessarily have a paycheck coming in the next 2 weeks, so you want to start to restart the economy. I just want to echo what Jason said about this issue of states. There is now going to be a surge of unemployment claims. Goldman Sachs estimates that when we get the numbers next week, 2 million additional people in a single week will go and file for unemployment claims. The states are woefully badly set up to process these claims and to pay them. We should be providing a lot of aid to the states to pay for unemployment insurance. We should also be increasing that amount. That's a faster way to get them money, by the way, than I think this wrangling that's going to happen in Washington before they're able to cut a check.
All right, well, then let's talk about how would they process even all these loans. Jason, if you think back to TARP, that was a logistical nightmare to process all of that. And TARP was this small when you think about all the companies that had to be supported. Think about all the business loans that are going to be requested.
Yeah, I mean, that's one of the big difficulties here. And it's a difficulty we had back then. It was a lot easier to do things for bigger companies than for smaller companies. We wanted to help a lot of smaller companies. We did a number of things for them, but it's just administratively more complicated. Anyone has to understand that right now the government is operating, way below capacity. You have people teleworking, people getting sick, people's children are home from school, and that's distracting them. And so pulling off anything now is difficult. That's why I think a lot of this is going to have to come from the private sector, with the government standing behind the private sector. So banks make the loans, the government guarantees the loans, make sure the banks won't lose money on those loans. So you get a lot of people into the business of providing this money, not just the government.
Steve, where do you balance this public outrage where people are feeling like they don't want to see big companies and industries bailed out again? This is very different from 2008, which was self-inflicted. Right now, you've got companies across almost every industry that were healthy businesses 2 weeks ago, and now because of no fault of their own, their revenues are grinding to a standstill.
Stephanie, you make a really good point there, and I think Jason does too.
I didn't hear what you said, Steve.
It's just bureaucratically. I said you made a really good point.
I know. I just wanted you to say that again.
And that. I say it often. But here's the thing: it's really hard to give loans and administer these loans to small businesses. It's easier, and frankly, you can write bad tweets to me. It's more effective to give money to the bigger companies. Look, it's well to remember what launched the Tea Party in 2008. It was a program to help people with their mortgages. That created absolute outrage. So the idea that you could possibly have, tremendous, malfeasance in a program like this that's badly administered and badly overseen, that's going to be a political nightmare as well. If we're willing to take that excess or inefficiency, then okay, let's do it. But remember, that's what launched the Tea Party was the outrage over a mortgage program to help individuals.
Gentlemen, thank you so much for joining me. I really appreciate it. We're going to obviously be covering this for days and weeks to come. Empty store shelves have led to a massive surge in Amazon orders for grocery items, cleaning products, and basic staples. To keep up, the company announced it is hiring 100,000 new distribution workers. But the company itself, of course, is not immune from the coronavirus either. Amazon is temporarily closing a New York delivery station after one of its workers tested positive for the virus. Joining us now, Jay Carney. He is Amazon's Senior Vice President of Global Corporate Affairs and former White House Press Secretary under President Obama. Jay, you know what it's like on the inside and the outside. Amazon could be, at this point, the most important company in America for everyday Americans to get us stuff. What measures are you putting in place to make sure you don't go down?
Well, first and foremost, we are following WHO and CDC guidelines in our fulfillment centers, which are our warehouses and our distribution centers, to ensure that social distancing is happening, that extra deep cleaning is happening, that our employees aren't congregating unnecessarily, so that they can go about the business of serving our customers who, as you mentioned, are more in need than ever of delivery to their doorstep of essential items, household staples, medical supplies, medicines, and things like that. So we're very mindful of the fact that we're in a unique position here, that we've become essentially an essential service to customers around the country and the world. That's why we're hiring more people. We know that that's unusual in a circumstance where so many companies are having to close their doors and lay off workers. We want to invite folks who have been laid off or furloughed to come work for Amazon for a temporary period of time so that they can earn a paycheck until their old jobs come back. And hopefully, for the country, for the world, this won't last too long.
Well, let's talk about, listen, it'd be great. You're hiring 100,000 people to help you with a business that's one of the most successful businesses in the world. Amazon made $70 billion last year. Besides helping us in a way that helps you in terms of your profitability, what can you as a company do to actually help right now?
Well, first of all, we, in addition to hiring people and raising wages, which we've done, our minimum wage is now $17 an hour during this period, which is, as you know, well over double the federal minimum wage. We are also doing things like launching an Amazon Relief Fund, which gives loans and financial assistance to our delivery service providers and our Amazon Flex drivers. We're paying all of our janitorial and other support service contractors in our headquarters buildings, even though they're not coming into work. We're providing subsidized rent to the small businesses, the restaurants and things that locate in our buildings but are out of work right now. And we're doing things like AWS, as I know you know, our cloud services, cloud computing services company, has launched this morning something called the AWS Diagnostic Development Initiative, which is $20 million to help spur research, innovation, and development of point-of-service diagnosis for COVID-19. As you know, the diagnosis and testing is a real bottleneck. AWS has enormous capacity when it comes to cloud computing, machine learning, and the like. We're going to make those contributions to the appropriate research institutions and scientists to help move this along.
Have you considered anything from a philanthropic standpoint? When you think who can get supplies better than anyone, who can find the supplies, it's Amazon. Every day we're hearing about more and more hospitals that don't have basic protective gear. Has Amazon considered stepping in and donating those masks and gowns and sourcing them for all those hospitals, or possibly get a computer to every kid in America? They're going to be homeschooled indefinitely.
Sure. Well, we're looking, we meet every day as a leadership with the business leaders, Jeff Bezos, people like me, and go over important information about our business operations, and then move to brainstorming about ideas that focuses on ways we can help not only our customers but our employees and other people. We have a program called Amazon Future Engineer. We just announced that we're providing free online computer classes for middle school and high school students through that program
right
across
now,
the country.
in this time of crisis.
Right now,
in this
we're
time of
offering
crisis,
those services.
Could you be providing all of the equipment, the masks, the gowns? Could you do that? What about a computer for every kid?
We are prioritizing medical supplies, masks, and the like for health care institutions, hospitals. As you know, there's been an enormous shortage. We have donated quite a bit of supplies and provided in-kind services. Our challenge is getting our suppliers to get that product to us, which is why in our fulfillment centers, while everything remains for sale that's for sale on Amazon.com, we are prioritizing the intake and shipment of medical supplies, gowns, masks, hand sanitizer, and the like, precisely because there's been a shortage everywhere.
Well, if anyone can do it, you can. Thank you so much for all that you do.
I appreciate it. Thank you so much for your time.
Thanks for joining me. We talked a lot about business, big and small, who are hurting right now, and industries that have had to press pause as we fight to contain this virus. But what about America's most vulnerable? Those who were already struggling before this all began, like the more than 500,000 homeless people, many who rely on shelters where there's no social distancing, where beds are inches apart, or the 37 million Americans who struggle with hunger and rely on food banks and soup kitchens. Who is fighting for them as the rest of us are all in this together, fighting this global pandemic? Joining me now, three people who are fighting for America's most vulnerable. Jake Wood, co-founder and CEO of Team Rubicon, a disaster relief nonprofit. Claire Babineau-Fontenot, CEO of Feeding America, and Jason Kander, president of the Veterans Community Project. He served in the Army National Guard in Afghanistan and also served as Missouri's Secretary of State. I want to start by thanking all of you. Jake, to you first. We have spoken time and again with Team Rubicon stepping in after many, many natural disasters. How do you approach this one?
Yeah, well, this is unprecedented, as everybody's aware, and this is really a whole of America response. So we are positioning all of Team Rubicon behind it. You're right that predominantly we respond to natural disasters here in the States, but we also have a robust medical capability that we've been deploying internationally for many years. So we're pivoting back to the U.S. and looking how we can support with medical services domestically. But we also have over 100,000 volunteers, most of them military veterans, in every community across the country. Yesterday, we activated them in a massive nationwide Neighbors Helping Neighbors campaign, and we've already seen acts of service for the most vulnerable members of those volunteers' community in over 200 cities across America.
Let's talk about this idea of volunteers, Claire, because food banks, soup kitchens are reliant upon volunteers every night. When we're in cities across the country, when we're being told to stay in place, don't do anything non-essential, unfortunately, people often think about volunteering as non-essential. Do you have a manpower shortage?
In fact, we do. So let me begin by sharing with the audience that a significant majority of our volunteers in normal times, we have over 2 million people around the country who volunteer in our 200 food banks, 60,000 food pantries, and soup kitchens. And an inordinate number of those volunteers are, in fact, very vulnerable members of our society right now. Inordinately, they're elderly. So, and a lot of companies who had routinely come to us for volunteer opportunities, some of them are having work from home policies, and shelter in place is also impacting all of them. So we have been having a bit of a challenge. The good news is that there are partners like the one that you just talked to. Team Rubicon is actually inside of some of those food pantries with us, hand in hand, shoulder to shoulder, trying to help people when they need us the most.
Jason, you say that Americans are defiant and they don't want to change their daily lives, even in the face of a crisis. But now is not the time for that mindset, especially seniors who we need to be staying at home are saying, I'm all set. I don't need to follow these rules.
Yeah, you know, that's a real key trait of the American personality, right? It's just sort of an instinct. It's, I'm not going to let this situation change the way I do things day to day. And just as you said, that's not the right instinct in this situation. It actually reminds me a lot of, if people remember, the DC sniper. I was going to school at Georgetown at the time, and I was also an ROTC cadet. And I remember the whole ethic in town was, we're not going to let the terrorists win. We're going to go about our business. And I remember one of my ROTC instructors, a grizzled old sergeant first class, said, you know, there's a sniper out there. Stay inside. This is ridiculous. And that's really like pretty relevant at the moment. There's a virus out there. The best thing you can do is stay inside, and you can let organizations like ours get out there and do the work. We're on the ground in Kansas City, for instance, working with Team Rubicon as well, and dealing with the homeless population as a whole. Kansas City has really gotten out in front of it, but everybody who's not directly involved in that kind of work has to, you know, go against that instinct of defiance and do the right thing, which in this case is stay home.
Jake, help us understand. You have seen so many different difficult situations. How would you assess what we're looking at here?
Well, obviously, as I mentioned earlier, this is a whole of America threat and requires a whole of America response. And I think what's different here is it's hard for people to understand it. You know, it's easy for us to rally behind one another for an enemy that we can see. This is an enemy that nobody can see, and many people can't even understand. And I think to Jason's point, you know, Americans are defined by fierce independence. It's time for us to define ourselves by, you know, a fierce sense of community. This isn't about you. This is about your neighbor. This is about us taking the necessary and urgent steps to do what's necessary to protect our community. So we have to suppress that urge to look out for number one and rather look to our left and right and think about what can we do to get through this together.
Jason, your organization works with homeless veterans. We talk so much right now about the need for people to stay home, the need for people to respect social distancing. How on earth can you do that given their scenario?
Boy, it's a great question. I mean, obviously the homeless population cannot self-quarantine. They don't have somewhere to go do that. And this is something that cities across the country need to do, like Kansas City, and get proactive about, because you could have everybody in your town stay home, but the homeless population runs into this problem. They go to a shelter. Perhaps they're having symptoms. They get tested. Then they're told they have to stay away until the test comes back. So that encourages people in the homeless population to not get tested and instead to be around other homeless folks so they continue to get services. So the problem there is everybody in your town could stay inside, and then when this passes, you're still going to have a very transient population getting around town that could be carrying the virus. So people need to do like what we're doing here in Kansas City, working as organizations on the ground, collaborating on resources, and making sure that we're able to deal with that population as a whole. Because for us, the only way we can help our constituents, the homeless veterans in this case, is to treat the homeless population as a whole. So that's what we're doing right now.
Claire, we've seen images after images of grocery stores, box stores with their shelves cleared out. If people can't get the supplies they want to feed their families, people who can afford to, are you going to suddenly face a shortage of supplies you need to feed people?
Well, we're already starting to see some challenges in, for instance, the retail donation. It's the #1 source of food donations for us. And when there's a run on all of these grocery stores, that means that they're less well-positioned to help us. But one of the things I want to make certain to speak to, Stephanie, I do think that all of us can feel kind of helpless right now. There are things we can absolutely do, and most of these things we can do from home. The first thing I would recommend is that we be advocates right now with the government and ensure that as there are these packages, and I support and endorse the things that are being done, there's a bipartisan mood right now. We need to seize upon it and make certain that we are in these packages thinking about the most vulnerable of the vulnerable members of our society, people, some of whom have jobs. When they do, they very often have these lower wage, hourly payment, hourly jobs. They really need to be addressed in this package. Secondly, there's a way for you to donate. Now, let's say that wherever it is that you're sheltering in place happens to be a community that you love. Well, there are ways that you can reach out inside of this organization, as one example. But there are other organizations as well where you can reach out in your right in the community that you're sheltering in, and think about ways that you can help. If you go to feedingamerica.org, for instance, there's an actual locator that we have on our website that can direct you to the food bank inside of the community you live in. It can also direct you to the food bank where you were born, where you've played. There are ways that we can help. And then the third thing that I would say is we will get past this crisis. And when we do, I beseech everyone who can hear me to remember that before the crisis, as you mentioned before, Stephanie, there were 37 million people in this country at the height of this economy who did not have consistent access to nutritious food. 11 million of them were kids. 5.5 million of them were seniors. That number's going to grow. And the part of our economy that's going to have the most difficulty rebounding are the people that we were serving before this crisis happened. So I ask everyone who can hear me to go out, feedingamerica.org, look on that website, find ways to advocate, to donate, and let's please, please remember these people when all of this crisis is behind us.
Amen to that. Claire, Jake, Jason, thank you for all that you do. And now it's time to remember someone else. We've got some very, very sad news to report this morning. A member of our own NBC News family, Larry Edgeworth, has died due to complications from coronavirus. Larry worked most recently right here in 30 Rockefeller Center with us. Larry tested positive for COVID-19 earlier this week. According to his wife, Larry suffered from other health issues that led him to succumb to the illness. Larry, he's the big guy you see right there on the left during a shoot in Namibia back in 2011. He spent most of his 25 years at NBC News as a skilled audio technician, traveling the world to bring you, our beloved viewers, the news. Many of us here were fortunate to work with him. As NBC News chairman Andy Lack said in a note to employees just a few minutes ago, he was known as someone that you wanted to have by your side no matter where you were. One of his colleagues describes him as a gentle giant who would give you the shirt off his back. Larry is survived by his wife, Crystal, and his 2 sons. He was 61 years old.